thank you ladies so much for joining us.
Well, thank you, Jan and Rhonda. We are very, very thrilled to be here and to be able to discuss this with you guys and just kind of give you a brief overview of how we can help during the waiver process, but more importantly, just getting the knowledge to you about waivers themselves and how they can be a beneficial resource to a large variety of individuals. Towards the end, we will answer any questions you guys might have. I have Jessica Monaco alongside me today. She is the division manager for y'all's area, and she knows all things waivers, all things moms. So she's the perfect person to ask all questions to. Where I don't know the answers, she definitely does. And if we don't, we will find them out as quickly as possible. I'm going to go ahead and share my screen.
I just want to add something.
Yeah.
Put your questions in the Q&A and we will be monitoring them during the presentation. Thanks.
Thank you. Okay, so we are Moms in Motion at Home Your Way. We have two names for our organization because we service both children and adults. Any child under our services falls under the umbrella of Moms in Motion, while adult services are used through At Home Your Way. Pretty much just for paperwork purposes. There's no, you don't really need to dive into thinking too much about that. That's more on our end. You stay with the same people, you get the same type of care from us. No huge changes on our end with that. But we were started by a mom who had a kiddo who had been diagnosed with a disability, and she looked to find any and all resources available to give him a positive quality of life. And she stumbled upon Virginia Medicaid waivers. And when she learned all the things about it, which was a lot because it's Medicaid, she realized there were other people who needed to know about this as well, that just would get deterred from the process because it is overwhelming. And it took a long time for her to understand it all and really get in there. So she started sharing everything she knew with others and was quickly thereafter serving over 300 people out of her home, which was huge. So she decided she wanted to start an organization, but she didn't want it to be client and worker relationship. She wanted to make sure that our organization had a very personal touch. So typically with an organization like ours, we would not start helping individuals until they've already received a waiver. A very important thing about our organization is that she wanted to make sure we became the experts on all things waivers so that families and individuals who needed this information didn't have to be that for themselves. So she made sure that within our organization, every team member is very knowledgeable on these resources, and we can help families, we can help individuals before waiver services even begin. We'll help them with that initial question of what is a waiver, and we walk them through the entire process. And that gave us more of a personal touch, personal connection. And now we can look at the individuals we service as family rather than clientele. There are a few different types of waivers in the Commonwealth of Virginia. DD waivers are the most sought after. You have to have a diagnosis of a developmental disability or delay by the age of 22. So you can be 40 and you had that diagnosis at the age of 16. And so you could still get screened for this and get on the wait list. With that being said, there is a wait list. There is a long wait list, and it is prioritized by the level of care needed versus the length of time on the wait list. So we've seen people on the wait list for 6 years, and somebody who's been on it for a year and a half received services through it before the person on the wait list for 6 years. With that being said, if you are on that wait list, or if you've been diagnosed after the age of 22, or if you have any other type of disability diagnosis, a long-term disability diagnosis, you can get screened for the Commonwealth Coordinated Care Plus waiver. We call it CCC Plus for short. It offers some of the same supports and resources as the DD waivers, not to the extent as the DD waivers do, but you can receive your diagnosis of a disability at any age. You need to have a medical nursing need associated as well. And then you also need to require assistance with at least 3 activities of daily living. So mobility, bathing, communication, there's all types. And you have to meet that criteria in order to apply or get screened or get approved for this waiver. So we like to help walk individuals through the requirements, the criteria, kind of learn about individuals and see if any of these apply to them. With both of these waivers, they are based solely on the individual with the diagnosed disabilities income. So it's not based on household income like typical Medicaid. However, if you do not qualify for either of these, but you do qualify for Medicaid and you have Medicaid and you need some of these same resources and supports, there is the Early Periodic Screening, Diagnostic, and Treatment Program. This is not a waiver, it is a program, and it is for individuals up to age 21. So once you hit 21, you're no longer able to have this program, but it does provide some of the same resources, supports. The screening is done through a doctor, and you have to have Medicaid. So with the screening and application process, there's a lot of steps involved. There's a lot of technical terminology. There's a lot of confusion as to where you go, what number to call, all types of things. Even if you get the right number, you're on hold for hours and you just kind of get deterred. So we have a family resource specialist team. We call them FRS. And when you call our 1-800 number, that's who you get on the phone right away. They're the fastest route to us. And you call them and you say, I think I might need a waiver, or I heard about you guys, whatever the case. And they'll say, all right, well, let's hear a little bit about your story. What is it that you're looking for? What needs do you have? And then they'll walk you through the process of what waivers might be applicable to you and your family, what locality that you're going to go, or location you're going to go to based on locality. So there's different places you'd go for different types of waivers and your locality, and they are the experts. They know it all. They're able to tell you, hey, okay, well, you live in this county and you're going for the CCC plus waiver. Here's the number to call. So we walk them through that whole process of the initial questions and breaking it down in simple terms so it's easy to understand. But along with that, once you do get that number and you reach out to get screened for the waivers, the screening itself can be intimidating and overwhelming. So this team will also walk you through what that screening is going to look like. There's a lot of parts to it that is very intimidating to families and individuals. For instance, the nurses doing the screenings, oftentimes they can't explain what a question means. They can't coach you or guide you through the process. They can only ask the questions. So our FRS team will explain that to individuals and families and kind of walk them through, this is what it's going to look like. This person's not in your home to attack you or out to get you or anything like that. They just need to see what level of need is needed in your home. So they walk you through that whole process. And our team has been working together with families, with the individuals we serve, with legislators, with therapists, doctors' offices, disability resource organizations, all types of places to find out what works best for the families and the populations that we serve. What do they need? What's important to them and what's important for them? We've compiled this information so that we are able to advocate for families as well. For instance, right now, we've learned through COVID that it really is beneficial for telehealth visits in our profession. Before, all our visits were done in person. And for a lot of families, especially, we served individuals who are immunocompromised. It really benefits them not to have outsiders coming into their home or bringing unnecessary germs, that type of thing. So we're advocating for telehealth to be a permanent for this type of interaction with these individuals. We also are advocating for parents and spouses to remain able to be a personal care attendant in the home. So being paid through Medicaid to provide care for the the individual who is on the waiver. In the process of advocating, we also teach individuals and families how to advocate for themselves. And we do that by doing the groundwork for them. So we compile all the information of what we've learned is important to and for families. And we put it all together and we create the petition, and then we send it out, and we allow families who are interested in advocating for that cause also to start advocating on their own behalf, and they get to start sending it out, sign the petition, spread the word without having to do all the paperwork side of it, which is really nice. So up until this point, none of that is what we are actually supposed to do. We are technically a consumer-directed service facilitation company. And what that means is that when you're approved for a waiver, you can go to an agency and you can have them dictate everything to do with waivers. Oftentimes we've seen people who go through agencies, they really have zero knowledge of what waiver them or their loved one is on, what services are being used, any of it. Somebody takes over everything for them. And in some instances, that is very appropriate. It is what is best for that family. But in the event that a family or an individual would like to be in charge of their own services, that's where we come into play. We are paid through Medicaid. We are technically a Medicaid provider. We never charge families for any interaction with us ever. But where we come into play is you get that approval for the waiver, and then you decide that you want to be in charge of your own services. So we would come in and we would be like your administrative side. We would be your secretary type deal. We would teach you all things to do with the waiver, with the whole process. We would teach you what the waivers are, what resources are available through them. We coach through any changes that might occur. We help you complete all Medicaid paperwork in the beginning, and then we typically do most of the paperwork afterwards. So we are a big part of your administrative team, and we work with your support coordinator or your care coordinator that's assigned through the case to make sure that every service being used through the waiver is effectively used, it's needed, and to identify any new needs that might arise. On top of that, we also help individuals pick what managed care organization they're going to use through the waiver. So that's like your insurance company, and which one's going to work best for you, which one's going to cover the therapies, the doctors, which ones provide services in your area. That's a huge one. People wind up switching because their pediatrician might be covered under this MCO, but then they find out every other therapy service that they're trying to use, there are no providers under that MCO in their area. So we help them understand which MCO is going to be most appropriate and beneficial to them. We also help them pick a person to come into the home and help provide care for the individual. So the waivers pay for somebody to come in and help out with whatever activities of daily living are needed. And that's kind of on a case-by-case basis what the unique circumstances of that individual are. So there's different types of care that are provided through the waiver, but the waiver will use a payroll company. We call it a fiscal agent to pay the individual. So we help the person in charge. We're going to help them understand who's going to be a good fit to come into the home, family member, friend, or if it's even a stranger, we'll help provide coaching on creating a job description and getting the information out there. Where are some good sources to put that information out there? We assist with filling out all the paperwork and staying on top of it to make sure that the process is going as smoothly as possible with the payroll company. And we meet with the families monthly as well. So it's typically monthly. Every once in a while, it's every 60 days or every 90 days, but most of the time it is monthly that we are meeting with individuals and their families, because we want to make sure that for that month they're set, that any new changes that came up they're aware of, that any questions that they wound up having throughout the month that they're taken care of. We want to make sure that the individual coming into the home has been getting paid properly. So we just make sure everything being used through the waiver process is being used effectively, efficiently, and that everything is documented, because every year you have to get reauthorized through Medicaid. So you got to get reapproved kind of. So we do all that paperwork when we meet with you monthly. We're compiling that information. So when reauthorization does come up, we already have it ready. We can submit it to the families. They can look over it and say, yeah, that looks good, sign their name, and then we submit it. That also allows us time to make any changes necessary throughout the year. So an increase of hours or changes to MCO when it's time for open enrollment to come up. We spend a lot of time in that, making sure that for each individual that we provide services to, that they are utilizing every resource that's going to be beneficial to them through the waiver. All of this is done by our service facilitators. They are scholastically accredited, but the cool part about them is that almost all of them have a loved one on a waiver. So they have firsthand experience, the personal understanding of what reservation and fears are there, what it was like to walk through that process of getting a waiver, understanding all the things associated with waivers, the resources, the struggles, the questions, the fears, all of it. They understand it all, and they're able to empathize when families do feel frustrated or intimidated or overwhelmed, and they're able to take a step back and say, all right, I've been there. Let's figure this out together and how we can get through this hump with you. With that being said, we also want to make sure that our service facilitators are not biased. They're not inserting their personal experience or opinions on individuals that we serve. So everybody here at Moms goes through person-centered training. We want to identify what is important to and for the individuals that we work with. And so we go through this training and we learn, okay, well, even though I had a bad experience with this therapy or with this MCO or with this payroll company, this family, it's actually working out for them. And so I can't insert my opinion here because I know this is what is working best for them. So we want to make sure that everything that we do is specific to the individuals that we provide services for. And once people are approved for a waiver, all the fun stuff kicks in. So waivers can be paired with Medicare. They can be paired with other forms of insurance. They can take a primary form of insurance. And there are so many benefits associated with waivers. So they cover doctor's visits, medications, transportation, mileage reimbursement, incontinence supply. They have programs out there that if your employer covers a certain part of your insurance and it's employer paid insurance, they will help cover costs for up to 4 family members in other areas. So there's a lot of resources associated with the waivers that a lot of people just don't know about. They don't have the access to because they lack the knowledge on it. On top of that, each waiver recipient gets up to $5,000 a year for environmental modifications and assistive technology. One thing that we really see a lot of times with the individuals that we service, when they have a primary form of insurance and then they have a waiver, their primary form of insurance will say something like, well, you have a kiddo who elopes or runs off all the time, but they have a primary caregiver who's supposed to be watching them all the time. So even though you feel it's a necessity that your kiddo gets GPS support systems so that when they do run off, you have that tracking, the insurance is like, no, that's not necessary because you're supposed to be watching them all the time. Waivers are more disability specific, so they understand that there may be an extra need associated with the diagnosed disability. And oftentimes we do see such things as GPS support approved or ramps or grab bars or seizure monitoring systems. All types of things are approved. The process can be lengthy, and I know a lot of individuals and families don't like that part because it can take, 8 months from putting a request in to actually getting something in your home. But it's nice that it is at least covered through the waivers. So it's worth it, even though it can get frustrating the length of time it takes. So we ask that when you identify somebody who has been diagnosed with a long-term disability, they're struggling, they just need to understand what resources are available to them, just have them give us a call, or if that's you, give us a call. We can at least walk you through the process of understanding it. It may not be appropriate for you, but at least you reached out and you learned whether or not it is. And we'd like to identify that and get that information out to anyone who needs it. So the entire process with us, you've been through the screening, you've been approved for a waiver, and we come out to your house and we start filling out the paperwork to start services with us and help you with the Medicaid paperwork. The entire process from that point on takes about 8 weeks. And 4 of that alone is background checks on the individual coming into the house and providing services. So we walk you through it. We help you with all the paperwork through it, but it can take a little bit of time. There's not much we can do. It takes time for paperwork to get transferred and processed. And the one thing that we do try to do on our end is make the paperwork as flawless as possible. Medicaid is known for kicking back paperwork because it was a middle name and not a middle initial put on there, and not telling you the reason why they kicked it back. So we go through and we try to make it as flawless as possible so that the transition period from being approved from the waiver to receiving services is as easy as possible. And that is the 1-800 number. That is the fastest way to get somebody on the phone to help you out. You just call that 1-800 number, you hit 0, and you're talking to a FRS person. Additionally, we also have on our website a link that's you click our About tab and you click Refer Someone. And that is the most efficient way to get help. That allows you to put all your information in, give a little snippet of what type of services you're looking for or what needs you have, whatever it may be. And then we get to compile the information and reach out to you and make that the quickest phone call as possible, so we're not holding you up all day. Another thing about that link is that we have just created a new team called our Client Engagement Specialists, and they are the ones who are going to call you back if you use that link. They also are the team who, when they walk you through everything and they help you identify which waiver is going to be appropriate and where the locality is, this team will actually 3-way call the screening place for you. So whatever organization you're using to get screened through, they will 3-way call and they will help you set up that appointment if it's needed. So it's pretty cool. I think that's the most efficient way, and it gets the services started a lot faster, in my personal opinion. And that is it from us. Are there any questions?
We're very quiet today.
Yeah.
It's the rain, I think. I don't know.
I'm always quiet on
It's a
rainy
lot of
days, too.
information to take in at one time. Brianna, will you be sharing your slides with me? I mean, email them to me.
Yes.
So I can share with the attendees.
Yes.
Okay.
Definitely.
Thank you.
Yeah.
Do you mind if I ask a question? Because I get a lot of questions
No, go
from
for it.
parents that call. If they were denied, how long should they wait to reapply?
So for the CCC plus waiver, it's 30 days. I don't know about the DD waiver. What about that? Or EPSDT, Jessica?
So with the DD waiver, if they're screened and they're not found eligible, it's probably best to wait until they have received an official diagnosis, or if there's been a change in their circumstances. So a lot of times those things can be factors that would change whether an individual would qualify versus not qualify. Most people that are screened for the waiver that are under the age of 9, as long as they have a developmental delay, they're being found eligible for that wait list and then being put on it. But if they're over the age of 9, they are looking closer at that diagnosis, the need, the support system within the family. So as those things change, that's when criteria for approval for the wait list versus not would change. Now, the other thing that I always tell families is with the DD waivers, it would well, Brianna actually touched on it a little bit. She actually talked about how sometimes kids who are 6 get one versus we have a client that's 22 that has a stable support system that receives one, that needs one, but doesn't receive one before that 6-year-old, because maybe that 6-year-old's parents had passed away and their whole support system was destabilized. So with the CCC plus waiver, it does work a little bit differently, but the DD waiver, I would look for those changes in circumstance, an actual diagnosis being made, or even just an escalation in behaviors, condition, anything like that.
Any other questions? What about for EPSDT, Jessica? Is that something that you'd have to, that you can get rescreened for? Because I know that's through your doctor.
Well, so when it comes to EPSDT services, it really does rely solely on the recommendation of the provider. So if your doctor is not on board with your need for assistance or your report of how much assistance you need, ideally, it's not going to be any different the second or third time. Again, that would be a change in condition thing. The doctor would have to identify a change in condition and in turn change their paperwork, because it really relies solely on the completion of that DMAS 7 form that allows for them to really make a change in regards to the number of hours or the level of support the individual is needing. I will also add for screening for the CCC plus waiver, just because you brought it up, and this is my pet peeve. I really do like to share with people that yes, you can be rescreened every 30 days. You can request a new screener every single time you are screened. I have a now 8-year-old on the waiver, and it took me many years to figure out that the squeaky wheel gets the oil. I had him screened every 30 days, and eventually they were like, she's not going to leave us alone. She needs help with this child. And he was granted a CCC plus waiver. So with that said, sometimes it's all about how you present your case and how you present your need, because ideally I was struggling with behaviors with my child. We were struggling with just emergency room visit after emergency room visit. We were really having difficulties, and I just kept calling, and I would call the supervisor and I would tell him, I'd be like, I'd like another screener for this. I was like, I already know the opinion of the screener you were willing to send out. So that is your right to request another screener, to request a screening every 30 days, and to advocate and to really be that voice of reason. I need help, because the more they understand that you need help, the more likely you are to get that CCC plus waiver, especially for children with developmental disability diagnoses and mental health diagnoses. Those behavioral issues can sometimes assist in fitting the bill for meeting CCC plus waiver criteria for qualifying for that.
And I sometimes tell parents that, remember, this is your child on his worst day. That's what you have to talk about. You always want to be positive about your child, but sometimes not when you're doing these screenings. This is on the child's worst day. Now, there is a question that was put into chat. Is there a low income requirement to qualify?
Okay, so Medicaid waivers waive the income requirements associated with Medicaid. So EPSDT services is the program that we would send people through if they did not qualify for a waiver, but they already had Medicaid based on their income. So keep in mind, they do not have to be low income in order to qualify for that waiver, because the waiver itself waives the income criteria associated with Medicaid. And if they did make over the income amount associated with for Medicaid, they would have a patient pay that they would pay towards their services. But keep in mind that children And those who don't have any income, the Medicaid waiver also waives the household income and only looks at the individual actually receiving services.
Mhm.
Yeah, it's funny that you say that about the worst day, because I actually just had a conversation with my service facilitator here recently. She was like, so tell me about what it looks like to, bathe, dress, toilet. And I was like, oh, and she was like, can he set the water temperature? Can he get all of his clothes off? Does he wash everything? Will he just stand in there? And I was like, gosh, why do I not think about these things anymore? But for parents, it becomes the day to day. You don't remember what the worst day looks like, because if you focused on the worst day every single day, where would we really be getting?
Yeah.
Right. So it's hard to turn those gears in order to conduct this screening. And like Brianna said, they won't coach you or guide you in any way on how to answer their questions. It's just, what does it take to bathe Sally? What does it take to dress Sally? Like they cannot tell you, oh, well, do they have trouble with buttons, or like they don't ask any of those questions. So it makes it the burden of proof in a way is on the parent, which makes it complicated.
Yeah. Other questions?
There's another one. It says how much income or how much money can the individual have to still qualify for the DD waiver?
Okay.
So DD waiver income criteria is exactly the same as the CCC plus waiver. The waiver waives the income requirements associated with Medicaid.
And it's just over 2,400 is the
Is that the
income
2022
limit.
number?
Yeah, so far that
Okay.
I've seen. It's still at that right now. Just over 2,400, and anything over that, like Jessica said, that just means you may wind up paying out of pocket. It doesn't necessarily mean that you're not going to qualify for the waiver. You just might have a monthly premium that you're going to pay also.
Yeah, I think, and they can't have more than $2,000 worth of resources outside of like living in their home. So they can have a home they live in, but they can't have another home. All of those kind of things are kind of looked at when it comes to resources and assets. But typically all of that is explained when we go through the waivers, when we go through the waiver coaching process.
We don't see any more. Income was a big one, I guess.
That
And
often
it is.
is.
It's hard to understand that it's basically your child's or the person going to receive services for the most part is the income that is used to determine eligibility.
Yeah, one of the biggest misconceptions about the
Mhm.
waivers is the
Mhm.
income requirement.
Yeah, I don't qualify. I make too much money. Well, it's not what you make necessarily. It's
Yep.
what your child.
That's
I
right.
once had a mom, she goes, I would never qualify for the waiver. She goes, me and my husband together make well over 6 figures. And I was like, well, I am happy to advise you that that is not going to play a part in this situation. She was like,
Yeah.
what? I was like, absolutely. I was like, we don't care how much you make. I was like, me and my husband make very good money too. I was like, and both of my boys have a waiver.
Okay. Well, thank you, Brianna,
Of
Jessica.
course.
I'll look one more time. Any further questions?
Oh,
How do trust income influence the income requirement?
so special needs trusts typically do not affect that, but any other trusts would need to be, you would need to use legal services in order to make them special needs trusts, or you would need to move that money out of that individual's name and put it in somebody else's as a guarantor, those types of things, because they do affect eligibility for using the services with no patient pay. Like I said, they would not qualify if they had too much assets
Right.
set aside.
What about ABLE accounts?
ABLE accounts aren't affected. ABLE accounts, special needs trust, all of that is kind of exempt from that Medicaid income requirements.
Okay. See if there's anything new.
I know I keep trying to
Are
check it. too.
family resource reps for Moms in Motion available on the weekends or just during the workdays? This is a working mom question.
So we are typically a Monday through Friday organization. However, if you go on our website and then you enter the information in through there, or if you leave a voicemail for the FRS team, you just tell them what time works best for them to reach out to you. Our CES specialists typically do work nights. So we do have individuals who that was part of the creation of that team was to make sure that we had people who were going to be available for working parents or working individuals. So they are able to reach out during weekday nights, and on the special occasion where you have to have them call you on a weekend, they will accommodate that.
Absolutely.
Very parent friendly.
Yes.
I
Well,
will
most of
say
us
that.
are working parents, so that's for sure.
And if you haven't been on the website, I mentioned this before we actually got started. I refer Moms in Motion website constantly because it has the best step-by-step explanation of how to apply for the waiver of anybody out there. Even better than ARC of Virginia, and they do a pretty good job too. But
Yeah.
I will say, I'm constantly referring your website to families, and I know Rhonda does too.
It
Yeah.
is comprehensive. We use our website a lot of times, training our families, even after they have started services.
Mhm.
We refer them back to that website because it's got quite a bit of information there.
We
Yeah.
use it ourselves daily too, when, during presentations, when I'm speaking with people and they ask a question, a lot of times I find myself looking on the website real quick to make sure I can answer it. It's
'Cause
very,
none
very
of us can know everything. We just
Right.
can't, we know who to send people to. That's a lot of my job, information and referral,
Yes.
because there
Yeah.
are
Traffic
other people
director.
out there who are more expert than I am. I know
Yes.
a little bit about a lot of things, but
That's a
not,
good way to put it.
My husband always says I came to work at Moms in Motion because I had a bunch of waiver knowledge that I have nothing better to use it for. He was like, she ran out of people in our social network to share this with, so she needed some new people. And I was like, that's terrible. He was like, no, he's like, that's a good thing. He's like, you found an outlet for it.
Yeah.
it's a great organization. I will say that.
Thank you.
It's very
Thank
good.
you very much.
Been very pleased with you over the years, and I know a lot of families have as well. Other questions before we log off for today? Okay.
You're very welcome.
Quickly before we go, if anybody is currently using services with Moms in Motion, since I am the division manager for Division 9, I always like to tell people if you have any questions, concerns, problems that you're running into with services, we are a company that likes to get ahead of these things. Please, by all means, if anybody is experiencing any difficulties with the use of services, the delivery of services, please do not hesitate to reach out to me. Let me know so I can get to the bottom of it. We can't fix problems we don't know about. So I always open that door and welcome people to come to us if they are having concerns. I put my contact information in the chat at the very beginning. By all means, feel free to dial that extension. It'll come right to me. So
Yes, and it will be included in the follow-up email with the slides. So you are free to share our contact information, both of ours and the slides.
Thank you.
Yeah, definitely.
Extension 2141. Got it. Okay.
Well,
Thank
thank you
you.
so much
Thank
for
you
having
again,
us.
Ladies.
thank you so much.
Thank
Have a
you.
wonderful
Rhonda,
day.
good to
for
see you
coming.
again. And thank you everybody for attending today. It was a good group. Thanks.
Thank you so much.
Thank you.
Bye.
Bye.